Welcome to eHealth Radio. I'm Linda DeWitt. Joining me is Dr. Sumeet Bhatia, medical oncologist with Community Health Network, also an MD Anderson Cancer Network certified physician. Our topic is kidney cancer. About 65,000 new cases of kidney cancer were diagnosed last year in the U.S. That's according to the American Cancer Society. Overall, the lifetime risk for developing this disease is about 1 in 63, and the risk is higher in men than in women. Dr. Bhatia, let's talk about really some of the risk factors. Who is most at risk for developing kidney cancer?
The strongest indicator of risk is age. As patients become older, they're more likely to get kidney cancer. There is a slightly increased risk with smoking. But other than that, the single most important factor is genetic.
Now, we've heard of some other potential risk factors that might include certain medications or chemical exposures. What do you know about
the
that?
risk associated with that is minor and not quantifiable. So I think in our practice, while we talk about them, their clinical relevance is somewhat uncertain. Genetic factors are probably the single most important factor that I think should be looked for and is oftentimes missed in screening of renal cell carcinomas.
So really just a close relative in your immediate family?
Yeah, that would be very important, and especially a history of multiple malignancies is important. Some of the renal cell carcinomas are associated with neurological syndromes, and we should look for it. There is a disease called von Hippel-Lindau, which is rare, but there are what we call form fruste forms of von Hippel-Lindau, which may be missed, and I think an astute clinician should be looking for those.
Okay. What are the signs and symptoms typically of kidney cancer, and do they always show up? Do you always know that something's wrong?
No. A large number of renal cell carcinomas are diagnosed incidentally. Patients are screened and have a CAT scan done for some other condition and are found to have a mass on the kidney. In the years before CAT scans, oftentimes patients would present with anemia or a low hemoglobin and fatigue. That's why in the older literature, renal cell carcinoma used to be called the internist's tumor, because that's how it was diagnosed. In the modern era, patients present either with hematuria, which is blood in their urine, pain in the flank, but in my practice, the most common way is actually an incidental CAT scan showing a mass.
All right. So typically it's diagnosed through a CAT scan, through some type of an imaging tool. Once a person is diagnosed, how is this disease treated?
The single most important component of treating this disease is surgery. At community hospitals, there is the capability of doing this surgery laparoscopically and with robotics, which is an excellent way of curing this cancer. And
laparoscopically is not invasive?
It's not invasive. So it's with three small incisions and with very, very quick recovery. There are some papers which have come up recently, which suggest that if somebody is more than 70 years old and is found to have a small mass on the kidney, we should carefully take into consideration what other medical conditions they have. And so, while renal cell carcinoma needs to be evaluated by an oncologist and a urologist, depending on the other medical condition that they have, it may not be unreasonable in 2014 to even observe some of these masses.
What about survival rates? We hear about survival rates for other types of cancer, but kidney cancer probably not so much, top of mind. So what are we looking at there as far as how treatments are today?
Stage 1 and 2 renal cell carcinomas are highly curable with 80 to 90% cure rates. Stage 4 renal cell carcinoma also we are able to risk stratify patients by various tools, and survival can vary from 10 months to more than 5 years. Renal cell carcinoma has been remarkable in the last 10 years in terms of the advances made. In 2000, there was only one drug approved for it, interleukin-2. Today, there are at least 8 different drugs which can be used in the treatment of renal cell carcinoma in patients who have stage 4 disease.
And that's what I wanted to ask you about next, what are some of the new advancements in cancer research and treatment? You mentioned some new drugs. Anything we're looking at? How far away?
We have a number of agents which include, most of which are what we call targeted therapies. In 2000, we used to treat people with a drug called interleukin-2, which was an immunostimulant. Currently, we have a number of drugs which belong to a family of drugs called tyrosine kinase inhibitors, which are basically pills and are able to control the cancer. There is an injectable drug called temsirolimus, which also is used in high-risk patients. Also, a drug called bevacizumab or Avastin, which is widely used in other cancers like colon cancer and lung cancer, is nowadays approved in the treatment of renal cell carcinoma.
Now, are some of these drugs chemotherapy? You mentioned that you might be a pill, but what about chemo or even radiation?
They fall in the broad category of chemotherapy, but in reality, these are newer drugs. These are specifically directed towards enzymes and molecules in the kidney, in the tumor, and so do not have the side effects of traditional chemotherapy. Traditional chemotherapy, which causes nausea, vomiting, hair loss, those are not the side effects that we see with these drugs. For example, the commonest side effect with bevacizumab or Avastin is high blood pressure. The commonest side effect with Sutent is a low thyroid function and fatigue. As a matter of fact, I would dare say that in most of the drugs that we use in the treatment of kidney cancer, nobody has hair loss.
Lastly, is there anything that the general population can do to try to prevent kidney cancer on their own?
Renal cell carcinoma is not a preventive disease, and that's unfortunate. But having said that, due diligence from a primary care physician, attention to family history can save lives. I would also say that nowadays, if it is diagnosed with modern treatments, generally survival is excellent.
Dr. Sumeet Bhatia is a medical oncologist with Community Health Network and also an MD Anderson Cancer Network certified physician. For more information about cancer services available at Community, visit ecommunity.com/cancercare. You're listening to eHealth Radio at Community Health Network.